is off this hour. Shadow Health Secretary Stuart Andrew. Stuart, a very good morning to you. Here we are, day one of this doctor strike, resident doctor strike. What on earth do we do? Is that rain around you? Is it pouring with rain out there? I thought I could hear rain.
It's the fog we've been talking about.
It's just very foggy here.
Yeah, fog. I know we were talking about that earlier, Stuart. This doctor strike, though, what on earth do we do about this?
Well, look, it is totally unacceptable that the BMA yet again are going to take resident doctors out on strike. And it's particularly awful right now because we have so many new cases of flu patients in hospital. This is a moment at which the doctors should be in the hospitals caring for those patients. And, you know, the reality is the figures that we've been looking at is suggesting that about nearly 9,000 appointments will be lost each day during these strikes. That's 9,000 individual people who were expecting to have treatment, who were expecting to have operations and had psyched themselves up for that, are now not going to have them. And I think that is appalling.
Yeah.
Using the internet without a VPN, a virtual private network, is a bit like taking to the road without car insurance. All it takes is one unlucky moment to cost you a lot of cash. This video's sponsor is Private Internet Access. They are the VPN to help keep you safe. Click the link in the description below to find out why over 30 million people have downloaded PIA to protect themselves online. A virtual private network is an app that hides your IP address and helps keep your data private. When you're browsing the internet at home, you give up a large amount of data to businesses, to shops, and indeed to social media giants too. Hackers have the ability to steal your personal data with ease, including sensitive information such as passwords, keystrokes, and even your personal photos. Private Internet Access helps protect your personal data by encrypting your internet connection to keep your data out of the hands of cyber criminals. And it's not just hackers either to be concerned about. Information can be censored too. When Canada passed their C18 bill, social media giants decided to ban news content on their platforms. But PIA can protect your ability to consume the news and content you love. Private Internet Access is available for Windows users, Mac OS, Android, Linux, iOS, and you can use one PIA subscription to protect an unlimited amount of devices. And we've got a huge GB News discount for you too. Click the link in this video's description and you'll get a massive 83% off PIA. That's under £2 a month, the price of a coffee, and you'll get an extra 4 months completely free on top. Also, there's a 30-day money-back guarantee too. Visit piavpn.com/GB News to start protecting yourself digitally today.
I get all that, Stuart.
You asked what we should do about it.
What is also appalling is the way we train doctors and how we retain them or don't retain them. The system is obviously broken, and it is wrong that we train doctors for export around the world, to Australia, to New Zealand, to Canada, whatever. Would you accept the system is broken and there's got to be something differently done in the way we train doctors?
Well, look, I welcomed the statement that Wes Streeting made in Parliament about the improvement in places for UK doctors. And I said, you know, he said that we would have to bring in emergency legislation, and I made the offer that we would work with him to achieve that. But the reality is that, you know, an inflation-busting pay rise was given by the government last year, but without any conditions or any reforms whatsoever. So it was inevitable they were going to come back for more.
Stuart,
the BMA statement itself said that the strikes are working.
Stuart, you're paying these qualified people less than 20 quid an hour. Like, come on. You can talk about a 26%
no,
pay
hang on a minute. You're talking about...
Yeah.
You're talking, well, hang on a minute. Let's just remember that you're talking, the way that these payments are made are done in different ways. So there is a basic amount, but then there are obviously add-ons as people get more and more qualified. But they got 29% and without any conditions. They now want 26%. What about all the other staff within the NHS? The country simply couldn't afford to give those sorts of figures to all of the staff. And it is a bit hypocritical hypocritical because the BMA themselves are in dispute with the people they employ. They offered them a 2% pay rise. So, this is not acceptable. There are patients suffering. That's my priority. And I believe that they should get back to work because there are patients in our hospitals who need treatment. And there are people now who are at home who are expecting to be treated today and over the course of the next few days who are not going to get those treatments. And we've been getting comments and emails from people from all over the country who are telling us about their own personal experiences. A woman whose cancer treatment she was expecting is not going to happen today, and she's deeply worried. In her own words, she's fearful for her life. And another woman who was going to have a double mastectomy as a prevention measure got herself all geared up. That's been cancelled. That's the reality of what is happening with these strikes, and that's why it's appalling that this is happening, especially as we're in the middle of this flu issue.
I think we can all agree that this dispute needs to come to an end. It's plagued your party, it's plaguing this government now, 14 strikes since 2023. But what's the answer, Mr. Andrew? Because the Tories held firm, didn't pay out anymore, strikes continued. Labour government has paid out, and yet strikes continue. So where do we go next? I mean, the BMA, they've got a mandate till the 6th of January. They will probably reballot. We could see strikes for a further 6 months. When will this end?
Well, exactly, and that is why as a party we have made it clear that if we get into government we will ban doctors from striking, just as we do with the police, with the army, with our prison service, because they're critical services, and that's why we would introduce that ban. But I'm afraid that things probably are going to get worse. You're right, they will ask for a mandate because things will get worse because the government are bringing in the Employment Rights Bill, which actually reduces the thresholds that unions need to ballot their members for strikes, and they get rid of the minimum service levels that mean that you don't get the proper service levels within our hospitals. So I'm fearful that things will get worse, but that's why we say very clearly, very strongly, we've got to have a backbone, we've got to show leadership, and we should ban doctors from striking.
Mr. Andrew, I don't know if you saw our GB News exclusive interview yesterday. It was with a very, very brave teenage victim of sexual assault, a very brave young woman called Abby. And she was telling GB News about being sexually assaulted by an Iranian asylum seeker. Now, her attacker is currently on remand in prison. He has pled guilty to 4 counts of sexual assault. Now, the Home Office won't tell GB News if this man is going to be automatically deported. Do you think he needs to be automatically deported? Do you think any asylum seeker who's committed a sexual crime against women and girls should be automatically deported?
Well, first of all, I can't imagine what the victim has gone through, and my thoughts go out to her. And my goodness, these victims that are speaking out are incredibly brave, and I thank them for doing so. And absolutely, yes, they should be deported. You commit a crime like that against people in our country, you do not deserve to stay here.
Sarah Jones, I mean, what Ellie was referring to there, the Crime Minister, we had her on the show about an hour ago, and she's trying to join up the health systems and various branches of the health system to protect women who have been subjected to violence and children who've been subjected to this sort of violence. I often look at the NHS and I think, I mean, it's all a good idea, but it is not, Stuart, joined up. It's not joined up. And can we ever achieve anything? Can we ever save money? Can we ever be effective? Can we ever treat the people we should be treating unless it is more joined up?
Well, I think you make a very good point. When I took on this role at the end of July, I've taken it upon myself to make sure that I've engaged with all parts of the NHS and social care to try and fully understand, the whole mechanisms. And actually people within it themselves say there needs to be more joined up thinking. There needs to be a much better approach. The fact that sort of IT systems don't talk to each other, the fact that groups are doing things individually and not in a united way needs to be looked at. And that's exactly what we as a shadow team are looking at now as we consider our policies for the future. We want to make sure that it is more efficient, that it is more focused and that actually it's joined up thinking, because at the end of the day, we want patient experiences to be smooth and effective.
Okay, Shadow Health Secretary Stuart Andrew, thank you so much for your time this morning on GB News Breakfast.
Thanks, Stuart. Thanks very much indeed.